My name is Gary Gilyard. I am an orthopedic surgeon. I specialize in sports medicine. I work for the Detroit Medical Center, and we are owned by Vanguard Corporation. I am sports medicine fellowship trained, and I take care of knee, shoulder, and athletic problems. I did my orthopedic residency at George Washington University. When I was there, we helped take care of the Washington Bullets and the Capitals. We also took care of George Washington and Georgetown University. During my fellowship at NYU, we took care of the New York Islanders and also did some work with the New York Jets. Well, I do see a lot of shoulder injuries, and some are chronic. Some are patients that haven't been seen or haven't had a diagnosis for 2 years, and they come in very atrophic, very contracted. Some people have multiple problems. They may have a ligament problem where the ligament is stretched out, ballooned out. The labrum, which is the attachment of the ligament into the glenoid, may be torn away. They may have a biceps tendon tear. They may have a rotator cuff injury. The rotator cuff injury can be massive. It can be essentially involving all three of the major muscles of the rotator cuff pulled away from the bone. And there's always arthritis in the AC joint and impingement. So all of those things can even be combined in one patient. But the main thing I'm trying to get is motion. The shoulder has to have motion. And if you don't get that motion early on, you're just behind the 8 ball when it comes to strength. You have a certain period of time after surgery to develop your motion. And then after that, when the scar tissue comes, if you can't get the certain ranges, you can't get good full functional strength. So I found that the Dynasplint is very useful in helping me get that range of motion very quickly. And it's something that can be done over a gradual period of time. In therapy, when someone goes to therapy, they go that one day, and there's 1 hour, probably not even an hour of manipulation or stretching at that point. And with the Dynasplint, it's something they can just use at home, and oftentimes I tell people that the longer they use it, the better. And the people have to understand that it doesn't have to be used so much so that someone's cranking on the arm. Just getting a very gentle stretch. A lot of people feel that really helps, and it makes them feel less pain. And the more they do it, the easier it gets. And the easier it gets, the more they do it, and then they find themselves actually feeling pretty comfortable using it. Any patient that I feel isn't really making really good progress when I see them at that 5th day post-operatively, if they don't have good motion when I examine them, if they're squeamish or they're having a lot of pain or they're really a little skittish about moving their shoulder, I will not hesitate to order the Dynasplint because it can only help. I've never once gotten a Dynasplint and said, boy, I wish I hadn't done that. So if you really think about it, if you're concerned about it, I would say you should just go and get it initiated and get it started. It can only help.